What is group B Streptococcus GBS? How can GBS affect babies? How can we prevent GBS infection in newborn babies? Hi, Group B Streptococcus GBS infection, this is the topic for today. Group B Streptococcus GBS infection in babies is a significant concern. It may be significant concern for parents, especially because it involves a common bacteria that is found in the body that can be harmless in adults as adults. We have mature immune system, but it can be potentially dangerous for newborns because they have immature immune system and they cannot fight infection the way we do. What is group B Streptococcus GBS? Group B Streptococcus GBS, it's a type of bacteria that it can be found in our digestive tract or lower genital and urinary tracts. It's quite common in adults, and usually, as I mentioned, it does not cause any symptoms or problems. Group B Streptococcus GBS colonization is quite common among pregnant moms. About 30–40% of pregnant women are colonized with GBS in the rectum or vagina at any given time during the pregnancy. However, GBS can be passed from the mother that doesn't have any symptoms to the baby during delivery, potentially leading to serious infection in newborns. How can GBS affect babies? Group B Streptococcus GBS is considered dangerous to newborns primarily due to their underdeveloped immune system, which makes them more susceptible to infection. As I said, they cannot fight infection the way that we adults do. When the baby is exposed to GBS during delivery, there is risk of the baby contracting the bacteria, and this can lead to severe and potentially life-threatening infections. The two main types of GBS disease in newborns are early onset disease and late onset disease. Early onset disease, this occurs when the baby is exposed to GBS during delivery. It typically presents within the first week of life, often within the first 24 hours after birth. The manifestations can include pneumonia, which is infection in the lungs, or it may be more serious infection that is called sepsis, which is a severe blood infection, or meningitis. This is an infection of the membranes that are surrounding the brain and spinal cord. The signs of early onset GBS disease may include difficulty breathing, problems with breathing, unstable temperature. Babies usually don't have fever, they have rather lower temperature. Feeding problems, those babies may be lethargic and they may be irritable. Early onset GBS disease has been significantly reduced with the introduction of intrapartum antibiotic prophylaxis for GBS positive pregnant moms. Late onset disease, this form of GBS disease occurs in babies aged 1 week to a month of age. Late onset disease, it's not as well understood as early onset, and it's not entirely clear how this infection, late onset, are acquired, though transmission could still occur during birth or potentially from another source. Like early onset, late onset disease can lead to serious conditions such as sepsis, bacteremia, meningitis, and infection in the lungs, pneumonia. The symptoms are similar to those of early onset disease, but occur just later in baby's life. How can we prevent GBS infection in newborn babies? As I mentioned, GBS colonization does not usually cause symptoms or problems in pregnant moms. However, because of the significant risk it poses to the newborns if it's transmitted during delivery, screening for GBS is an essential part of prenatal care. The goal is to identify those moms who carry the bacteria so that appropriate interventions, such as administering antibiotics during labor, can be taken to reduce the risk of early onset disease in newborn. What is the screening for GBS in pregnant moms? The Centers for Disease Control and Prevention, CDC, recommends that all pregnant moms be screened for GBS. The screening is typically done between 36 and 37 weeks of pregnancy, and the test involves collecting a swab from the lower vagina and rectum and then analyzing it in the lab to check for the presence of GBS bacteria. What is the treatment for GBS in pregnant moms? If a pregnant woman tests positive for GBS, she is given antibiotics during labor to reduce the risk of passing the infection to the baby. The most common antibiotics that is used is penicillin. It's very effective and it has low risk of side effects. For women that are allergic to penicillin, alternative antibiotics could be cefazolin and clindamycin, depending on the sensitivity of GBS strain and then the type of allergy. How do we manage and treat newborns with possible GBS infection? If a newborn is at risk of GBS infection, for example, if mom is tested positive for GBS, or if there was a previous baby with GBS disease with previous pregnancy, or the newborn baby has any signs and symptoms or infection, if they are present, close monitoring and possibly treatment are initiated. The monitoring includes checking the baby's temperature, checking the baby's heart rate, breathing, feeding behavior, and overall responsiveness. The treatment typically involves administering 2 intravenous antibiotics to the baby immediately after birth to combat the infection. In conclusion, GBS is dangerous to the baby because it can lead to serious infections which if they are not treated promptly, can result in long-term health problems or can be even fatal. The underdeveloped immune system of a newborn makes it harder for them to fight off infections, which is why prevention through screening and treatment of GBS in pregnant moms is crucial. The use of antibiotics during labor in GBS-positive mothers has significantly decreased the incidence of early onset GBS disease in newborns, showcasing the importance of prenatal care and GBS management strategies. If there are any questions or comments regarding GBS infection, please contact me at contact me at neonatologyforparents.com. Thank you.